Hello and welcome. My name is Dr.Novick. I'm an emeritus clinical professor of dermatology at the Mount Sinai Medical Center in New York City, and I have a private practice located on the Upper East Side of Manhattan devoted to cosmetic dermatology. In today's video, I'd like to discuss the agony of acne scarring. Acne scarring is a problem that can be lifelong for people and destructive both emotionally and socially and professionally. And it's one that I'm confronted with in my private practice every single day of the year, with people who are coming to me absolutely distraught over acne scarring and not knowing exactly what to do to be able to better their lives. First, I'd like to discuss what kinds of acne scarring there are. There are several kinds of acne scars, and I've made a drawing to make it quite clear what each type of scar is, because I found that there's a lot of confusion by people who come to me for what kind of scarring they have. The most common kind of acne scar is called the ice pick scar, and it's called that because it's essentially like a cone being burrowed into the skin, but it's a pinpoint sized cone that's burrowed into the skin. This is the most common, and by far about 70 to 80% of acne scarring are of this ice pick variety. The second kinds of indented scars are the rolling scar and the boxcar scar. The rolling scar is called that because the edges of the indentation of the scar sort of gently roll down, making more like a gentle soup bowl. The boxcar is more like an indentation is more like a punch in the skin, where it goes straight down and makes this box-like shape. And the final kind of scar, and the least common kind of scar, is something that's just earned its name only a few years ago, and it's called the papular acne scar. And basically, it's a very small hypertrophic scar, overabundance of scar tissue sticking up from the skin rather than an indentation. I'm sure if you've been exploring and researching the treatment of acne scars, you've come across all kinds of proposed treatments like Fraxel lasers and carbon dioxide lasers and radio frequency devices and ultrasound devices and all kinds of light and energy-based gizmos to treat acne scarring. But essentially, there are only a few treatments that have stood the test of time. For the ice pick scar, the treatment of choice is what's called TCA cross. It's a procedure that I've been using since it was introduced about 25 years ago. I've used it in tens of thousands of people to treat ice pick scars. TCA cross, the cross stands, CROSS, stands for collagen reconstruction of skin scars. And what is basically done is a very strong acid, usually trichloroacetic acid in various high concentrations, or sometimes phenol, is actually placed down the shaft of the scar, down the shaft of the ice pick portion of the scar. Now, if this acid were placed on the surface of the skin, it could cause all kinds of problems. But the acid in this case is placed down the shaft of the scar where nobody will ultimately see it. And it works on the principle that the final stage of any healing process, and of course the acid causes an inflammation that leads to a healing process, the final stage of all healing processes is called scar contraction. And so after you irritate the inside of the ice pick portion of the scar, the shaft of the scar, eventually as part of the healing, the walls of the scar come together. And you can imagine if the surface of the scar is the circle that you don't like, that's visible of the ice pick, but as the walls come together, the top of the scar purse strings, and so the dilated ice pick scar becomes a much more tightened, less visible pore. The ideal treatments for indented boxcar and rolling scars, it's one that has stood the test of usage for safety and efficacy since 1995, when I first started to use it, is called subcision. Everybody knows that when you do an excision, you're cutting something out. If you're doing an incision, you're cutting into something. But a subcision all the cutting is done below the surface of the skin, where basically nobody sees it. A small needle-like or cannula-like device is inserted that's really no larger in diameter than you would use a needle for blood drawing, and it's inserted under the skin, under the base of the scar, and it's rotated in such a way to splice the tight tethering fibers of scar collagen that are holding down the scar in the boxcar or in the rolling positions. So it breaks up those fibers, but that's not the only thing that it really does. A brew in the potential space that's formed after the scar, the tethers are broken, a blood pocket forms underneath the skin, a bruise essentially, that contains the person's wound healing factors and growth factors. And these wound healing and growth factors are what stimulate peripheral cells, the healthy cells on the outside, on the perimeter of the scar, to produce new healthy collagen, new healthy elastic fibers, and new healthy dermis to give a more permanent result and to give the elevation and smoothing that is desirable. We're talking about treatment with TCA cross for ice pick scars or subcision for the boxcar and rolling scars. Generally, if you're extremely lucky, one treatment will suffice to get maximal improvement. However, for the vast majority of people, it usually requires somewhere between 2 to 6 treatment sessions spaced at no fewer than 6-week intervals between treatment sessions, because it takes time for the body to make new collagen and new elastic fibers and new dermis. So essentially, to have realistic expectations, one should think that it will require at least on average 3 to 4 treatment sessions of either TCA cross for the ice pick scars or subcision for the boxcar and rolling scars. The hypertrophic, the papular acne scars are treated differently than boxcar and rolling scars and ice pick scars. That can be generally treated in 3 different fashions: by the injection into each individual spot of an anti-inflammatory to help shrink and flatten the elevation, or to use what's called scalpel sculpting, the use of a scalpel with using local anesthesia to basically sculpt the bump flush, to remove it so that it's now flush with the surface. And the final method is to use electrocautery, a light electrocautery, to flatten the bump. What I generally do for my patients on their first visit is that I test each spot with each type of treatment to find out what works best for the particular patient, and then we can go ahead at a later date, a few weeks later, after seeing what the result was of the test sites, we can go ahead with whichever procedure gave them the best results. I've just spent this time discussing treatments that have stood the test of time for both the ice pick scars, the boxcar and rolling scars, and for the papular acne scars. I'm sure, as I said in the very beginning of this video, that you'll be confronted with a lot of different propositions for all kinds of expensive, light and energy-based treatments. But I would strongly suggest that you consider treatments that have stood the test of decades of time for both safety and efficacy in all skin types, including skin of color. Thank you for your attention, and I look forward to meeting you in our next video.